All right, and everybody should be able to see the PowerPoint presentation up on the screen. So if you can't see it, let me know. So thank you, everybody, for joining. We're going to be talking about the social determinants of health and our interactive neighborhood health tool that we put together for the Greater Nashua Public Health Region. So thank you for joining us today. And Dennis just said it's very small. Usually with the webinar, there's a feature where you can expand it to make it fill up the whole screen. See if you can find that button, and you can make it a little bit bigger. So if you're having trouble seeing it, see if you can make it fill up the whole screen. I just want to start off by some acknowledgements. A couple big thank yous here. One goes to Angelo Marino, who is in our GIS department here in the City of Nashua, and he was the one that actually took all the information and data that we collected and put it into GIS and was able to create that interactive tool that we're going to demonstrate later today. So a big thank you to him and his department for working with us on this project. And also a thank you to Robin Yoshida, who was an intern here at the health department last fall, and she was the one that actually put together a lot of the materials and the information that went into the map. And I thank you to our director, Karen, who kind of helped us oversee the project and helped us in the final stages with editing. So just for a little background, we completed our 2014 Community Health Assessment in October, and within this health assessment we talked about a lot of different health priorities, from chronic diseases and infectious diseases to emergency preparedness, oral health, and mental health. And one whole chapter in this report is dedicated to the social determinants of health, which we're going to talk a lot about today. And while we were doing this, we received a request from one of our partners about how can we get some neighborhood health, and how can we look at some of these different indicators by neighborhood in our region. So that kind of got us started on this path and this little project of putting something together that residents and community members and stakeholders in the community can look at and reference to be able to get a little bit of information. So let's just start off with what are the social determinants of health, because this really impacts the work that we do in public health. And the WHO, or the World Health Organization, calls social determinants of health are conditions in which people are born, grow, live, work, and age. And these circumstances are really shaped by how we distribute money and power and resources, not only here at the local level, but at the national level and across the globe. So that's the definition that we hear most often when we look at social determinants of health. And here's just a picture that kind of starts to explain how these different factors are part of our community. So here at the center we have individuals, and our age and gender and our race and ethnicity. Those factors can affect our health. And then if we go a little bit further out in this circle, our social and community networks can affect our health, so how connected we are to people around us, what our support systems are like. And then if we go up a little bit further, the conditions in which we live, such as our housing, our work environment, and these other factors like education and unemployment kind of make this whole spectrum of social determinants. So it starts right at the individual and goes all the way up to our built environment. And the Centers for Disease Control and Prevention, or the CDC, has a little bit of data on social determinants of health. And in their report, only about 25% of population health is attributed to genes, biology, and health behaviors. So only a quarter of our health is attributed to that. The rest of it, the other 75% and three-quarters, is due to all those social factors and social characteristics. So that's pretty big if you think about it. Only 25% is for genes and biology and behaviors, and the rest is really determined by our environment and how we work and live and how that affects our health. So if we look at social determinants, here's a list of things that we look at most often, and these factors can relate to our health outcomes, such as the ability to get food, especially healthy food, and the quality of that food. Same thing with accessing healthcare services, being able to get to those services, and then what's the quality of those services, the type of housing that we live in, the amount of income that we make. All these different factors can really affect our health outcomes. So this is important because in order to achieve better health outcomes for a whole neighborhood or a whole community, we really need to start addressing these social determinants of health. And these determinants of health can help us achieve that health equity, where everybody has kind of the same starting point to achieve good health. And here's just a little image that kind of shows what equity and we're talking about with social determinants of health. The tree on the left, you can see, has a very poor foundation. It has poor work environments. There's unemployment. There's a lot of poverty. So the roots in this tree are not very strong. And then if you look at the trunk of the tree that really holds up all these branches, there's fragmented systems or those sorts of issues in the community. And then when you have to deal with all these different outcomes like heart disease and infant mortality and smoking, if you don't have a good foundation, you're much more affected by those health issues and conditions. And then if you look at the tree on the right, if you have quality schools and access to healthy foods and good health care, you have really strong roots. And if you have a strong trunk of social networks and peer support, then you have a much better ability to handle all these health outcomes, and maybe these won't affect you as much. So I thought that was a really nice image to kind of show what we're talking about here. So let's look big. Let's look national. Here is a map of the percent of the population age 25 and older that don't have a high school diploma. And this is looking at it by county, and this is in 2012. And this map was from the Centers for Disease Control. They got data for this map looking at the American Community Survey, which is done every year and collects a whole variety of different data. And if you look here, big picture, there are certain parts of the country that have very high rates of adults that didn't finish high school. So if we look at Texas, the southern western part of Texas, they have very high rates. Some pockets in California. Here in the southeast, we see more pink color here, so there are higher rates of people that didn't get their high school diploma. Fortunately, up here in the northeast, we look really good when we compare it to the rest of the country. But as we'll see when we dig down a little bit and we really get down to that neighborhood level, we still have disparities here. We still have differences when it comes to education. So here's one picture, and then this next one is looking at the same thing, rates by county, but this time it's poverty. So we're looking at what percent of the people in these counties are below the poverty level. So the darker the color red, the higher the percent people are in poverty. So again, this is a little bit more variety. You see a lot of red throughout the whole United States. So it's a lot more variety here than we saw with education. But again, big picture, you can see that there are differences at that county level. And here's just a couple data points that kind of helps drive home how these social determinants of health can really affect health outcomes. And the first one is looking at mortality rates for infants of moms that don't have their high school diploma, they don't have that degree, and they were 1.5 times higher risk for having infants that died than mothers that had more education. So the infant mortality rate's a lot higher. And then if we look at cancer death rates, it's 1.2 times higher among African Americans than among Caucasians. So whenever you look at health topics and you drill down to look at race and ethnicity or genders, education and poverty, there are these differences that we see. So let's start to bring us down a little bit closer to our region. So this is the Greater Nashua Public Health Region. The population is about 206,000, and then in Nashua we have a population of about 86,000. So it's a pretty populous region. It's actually the most populous public health region that we have in the state. And we have a lot of variety and diversity in our region. If you look at the City of Nashua, our percent of the population that speaks a language other than English is a lot higher than in our surrounding towns. But as we look in a few minutes, there are some interesting things when we look at poverty and educational attainment. So let's take a look at that. So here's our population that have less than a ninth grade education in our region, and this is looking at it by Census Tract. So Census Tract is one of the few ways that we can actually look at a neighborhood and get some of the data. You can go to little bit smaller than this, but sometimes the data isn't as reliable. So for our intents and purposes, we look at it by census tract. So in Nashua, you can see that we have about 15 different census tracts, and then our towns sometimes only have one or two that are the rest of the region. But here you can see that the darker colors show the higher percents of the population that have less than a ninth grade education. So in Nashua, if we look at the darkest areas, it's here in the center of the city, right around Census Tract 108 and 107, and 105 have the highest rates, and then it varies throughout the whole region. But then you'll also notice that there are still some pockets in the region where about 2 to 5% of those neighborhoods or those census tracts don't have higher than a ninth grade education level. So it is important for us to look at the whole region when we're talking about health and our different health priorities. Then we have one more map looking at our region, and this one is looking at the percent in poverty. So these are looking at the same two maps that we saw as the whole United States, but just here at our regional level. So we're really getting down into data that's important to us. And if we look at poverty, the darker blues are the higher percent of poverty, and then the lighter pinks are the population that has the less percent of poverty. So you can see that there are some interesting things here, that it's not just Nashua that has pockets of poverty in our region. Mason and Merrimack and Milford have these little pockets as well. So it's important for us to know this when we're looking at planning for different health priorities in our region. So again, you'll probably see some similarities where the darkest areas in Nashua for poverty were also the same darkest areas for education as well. And I just also would like to give credit to the National Regional Planning Commission for putting together this map, and to our GIS department here in the city for putting together the educational map. And if mapping isn't something that you've done in your region or in your part of the state, it's something that's interesting and useful. And later in the presentation, I'm going to talk about a tool that the Department of Health and Human Services put together that's all about mapping, and it might be of use and really helpful to you. So when we talk about neighborhoods, every neighborhood's a little different. You could even think about the own town that you live in, and you might know differences. This part of town has really nice fancy houses. This part of town may have more apartment buildings or might have a trailer park. This part of town has more grocery stores than that part of town. So every town has its own little distinct neighborhoods, and each neighborhood is a little bit different. And the characteristics of that neighborhood can really affect the health outcomes of that community. There's some really interesting data out there that shows if you look at neighborhoods and life expectancy, there can be some really big differences from one neighborhood to another. So let's just take two neighborhoods in Nashua, and let's look at how different they can be. So this is the same city. In neighborhood A, we have a neighborhood that has a lot of parks and green space. About 12% of the students are eligible for free and reduced lunch. There isn't a lot of violence in this neighborhood. The median household income is $110,000. About 4% are unemployed, and about 2% are below the poverty level. If we then look at neighborhood B, there are some pretty big differences here, where in neighborhood B, there's not as much green space. Some of the sidewalks, are in disrepair. 81% of the students are eligible for free and reduced lunch. There's more violence in this part of the city. The median household income is about $30,000, and 1 out of 10 are unemployed, and a third, or about 30%, were below the poverty level. So there are some pretty big differences between both these neighborhoods. And if you talk to residents in neighborhood A and then you talk to residents in neighborhood B, there are some pretty big differences in their health and their access to resources and their ability to seek healthy food items or be able to pay for those healthy food items, to be able to have access to those green spaces or those to be able to get physical activity. So there are some pretty big differences here. And, our goal when we talk about community health improvement and being able to make better health outcomes in a healthier community is to how do we help neighborhood B have more green space and more walkability? And how do we try and reduce violence in that neighborhood so that people in neighborhood B have a little bit of a better start and ability to kind of have the same advantages that maybe people in neighborhood A have? So a lot of our programs, and we'll talk about one in a little bit, are aimed at trying to equalize that a little bit. And here's one of our examples. So this is the Heritage Rail Trail in Nashua, and these are the before pictures. So this was a segment of the rail trail that had a lot of space, but it wasn't really being used very well. You know, the fence had some graffiti on it, and it just wasn't very pretty to look at. But if you look at this, this is an opportunity. This is an opportunity for us to say, what can we do? And the community health improvement plan, obesity prevention work group, along with partners from the YMCA of Greater Nashua and Nashua PAL and many other stakeholders across the city and the region partnered. They got together, they were able to get funding, and they turned this part of the rail trail around. And here are some after pictures where they implemented a community garden in this space. So this took a lot of work and a lot of community involvement, and it was great to see people rally around this initiative. And what they did is they took this one segment and they turned it into something beautiful. And although right now with all the snow, it might not be so beautiful, but in a month or two, it's going to be back to looking like this. We're getting it ready to plant a garden and to see that grow. And it's really fun to walk by and see the basil growing and the zucchini growing because it's a space that people can be proud of. It's a space that people can share and maintain and keeping. And this is just one example of how can we take these spaces, make them more useful and beneficial for that community, and then start to change how that community feels about that part of the city. You know, and they take more pride and ownership of it. So there are initiatives that we're doing on multiple different health topics, but this is one that just really shows how you can make some change on these social determinants of health and increase those access to healthy foods, and then also start to increase access to physical activity by making this maybe a little bit more populated space, especially in the warmer months, so people might feel a little bit safer by being able to put lighting on the rail trail, all those different things to help increase, health in this part of the city. So that all led us to creating this interactive health tool. So I'm going to start talking a little bit about what we developed and kind of where we see it going in the future and what we can possibly do with it. So we collected data from the American Community Survey, and we just looked at a few different topics. We didn't look at a whole lot. We wanted to kind of keep it somewhat narrow and focused. And the topics that you see in this image are the ones that we picked to put in this health tool. So we have education, employment and income, health insurance, some population indicators around gender and age, language, and then some on the built environment. And this is available on the City of Nashua website. Just a couple things about this tool. It's interactive and web-based, and it only provides data on a few of these social determinants of health. So we only picked a few narrow topics at first. And it provides neighborhood-level data for community members and stakeholders. And again, when we say neighborhood level, we did it by census tract. So some of the census tracts in our region are the whole town. So that's not maybe as small as those towns would like, but this is where we started at. And then this tool also includes some community resources. A couple of things that the tool's not is the tool's not a social vulnerability index, which I'm going to mention in a little bit, which is a really great tool. But our tool's not that complex, and it's not a complete data set of all health indicators, and it can't be used by itself for planning or to say, oh, this neighborhood needs this. It's not exactly what it's meant for, but it can be used as a tool for a larger project or community planning, but it just shouldn't be used by itself. You really need to have community buy-in and discussions with all those different partners. So just keep that in mind when you're looking at the tool. So let's take a look at the map. I'm going to pull it up. And here's the main page. And I'm just going to show you one way to get to this map, because sometimes it can be a little tricky to find things on the website. So here's the City of Nashua website. And if you go to Maps and Directions, Then here, if you open up Maps and Directions, it's Public Maps Gallery. So if you click on that, this is actually a really neat resource because it has all the different maps that are available for Nashua. And then here you'll see our neighborhood health map, and then it'll pop right up. And then to get in, you can either click on the image or you can click on this link here, and then it'll open up. Just let that populate. So what you're going to see is there are a series of tabs here on the left-hand side, and these tabs are those 6 topics that I mentioned a few minutes ago. And then here you'll see our region outlined here in black, and then the red lines are the different census tracts that you see. And then here on this main page under population demographics, we put the libraries and the town halls here. So you can see if you click on any one of these little icons, it'll open up. And then if you want some additional information, you can click More Info, and it'll actually bring up their website. So that's just one feature that we have right here on tab 1. And you'll notice that there's a little text box that will populate, and it just gives some basic information on what you're going to find here. So then if we click on a census tract, it's going to pop up with this little box, and you can pick any census tract that you'd like, and it's going to give you the data that's included in this tab. So here we have Census Tract 114, and in this tract we have a population of about 5,000, about 2,600 males and about 2,400 females, and then there's about 2,000 households. So it gives you a little data up there, and then here we just have a graph. And what's neat is if you hover over the bars, it's going to give you the percent. So here we're looking at percent of residents by age, and this is showing us that 9.7% of residents in the census tract are between the ages of 5 and 9. So it's kind of neat because you can just go over and you can see the different ages and what the different percents are. And then on some of these tabs, there's going to be a second graph or a third one. So if you notice, if you click that little arrow there, it comes up with a new one, and this one is looking at the percent of residents by gender. So here, the census tract is about 48% female and about 51% male. And then there's one more, or is there 2 more? There's 2 more. So on this one, you can see that we have percent of residents by race. So if you just hover over it, you can see what the numbers are. And then here is percent of residents by ethnicity. And we did it by Hispanic or Latino, or and that's due to the American Community Survey data and how that's collected. So really neat to be able to pick any census tract. You see if you click this one, it'll pop up with that information. And it's just an easy way to look at your community for data. So let's check out education. When we look at education, we put all the schools on the map, and you can click them and you can get their address, and you can also look and see how many students are enrolled or eligible for free and reduced lunch. So here we have enrollment for free and reduced lunch, and then the percentage of students that are eligible for free and reduced lunch is 8% at this school. So this is one of the schools in Brookline. So 8% are eligible at this school for free reduced lunch. And then let's see if we just go to someplace like Nashua and you look at this, the percent that are eligible is this one in this registry, it's almost 80%. So you can see some of that data for each school. And then if you click on the census tract again, you're going to come up with a graph. And this one is a pie chart, and it just shows percent of residents by education. So in the census tract, 21% have some college, and 33% are high school graduates. So you can just kind of see, you can go around the wheel and look at different ones. And then you can click and you can see what other census tracts are like. If we look at employment and income, this one doesn't have any, little icons to click on, but you can click on different census tracts, and it will give you the median household income, the percent in the labor force, the percent in poverty, for children, so for those under 18, and then the percent in poverty for adults, and then those over the age of 65. And if you hover over these columns, you can look at the income levels and the percents by different income levels. And then the one other piece that's on here is on percent of residents that commute to work. So you can see what percent are using maybe public transportation or are carpooling to be able to get to work, and what percent have walked. So you'll see a lot of differences in this if you look further out in the region versus maybe more inner city in Nashua. For health insurance, this one is just going to show us the percent that are covered with insurance and those that are not. And I'll just mention that this is before the healthcare marketplace or before the New Hampshire Health Protection Plan. The data is from the American Community Survey, and it's up until 2012. So we don't have that information yet, but it'll be interesting to see, over the next couple of years as we get that data, how this may have changed. So here in this pie chart, you can see the percent with insurance and then the percent without insurance. And then for language, we have the percent of residents that speak English, and you can have that data there. And the last tab, resources for individuals and families, this is something that we put little push pins with different organizations or agencies that may have resources. So if we click on this one, it's the YMCA of Greater Nashua, and it has the address and the phone number. And then if you click on this again, it'll pop up with their website. So this makes it a little bit easier to kind of see what resources are available in your community. With that, we created a one-page flyer that talks about what social determinants of health are. And this is really an easy-to-understand flyer that we targeted so that we could give it to residents and people that are not necessarily in the public health profession or the clinical profession, so that they could have a better understanding of what is this. And if you can get people in neighborhoods to start talking to one another and to start to try and make a change, you can see some big differences. A lot of times it's really those grassroots efforts that can really change a neighborhood. So this is a flyer. It has some information on the health neighborhood health tool that we were just looking at, and then it also has the link for our community health assessment in case people want to see a little bit more of the data. So for some of our next steps, we really want to gather some input and feedback from users that utilize this tool, and we would really love to add some additional resources to that tab number 6. If you look at that tab, we have a pretty good number of resources for the Nashua area, but once you start getting into the surrounding towns, we don't have a lot of resources. A lot that are there are more just the police and the fire and the town hall, the library, so we don't have as many. The further out into the region we get, and I think it would be really great if we could continue to add resources to that map. And when data becomes available for the 2011 to 2015 American Community Services survey, we'll update the data so that it has more current information on it. We're not going to update it every year, but we figured maybe every other year we could update that information and put that into the tool. So that's our health tool and kind of why it came to be, and how we somehow envision it being rolled out and used. And the next part that I just want to mention, because it's a really useful tool, and it's kind of like that next step where it looks at a whole series of social determinants of health, a whole series of indicators, and it creates an index, is social vulnerability index. This has been used a lot across the country for emergency preparedness planning and for public health planning. And the New Hampshire Department of Health and Human Services actually created an SBI tool for the whole state. And what it does is it helps to identify demographic groups or geographic locations that are more vulnerable to public health hazards or to, maybe public health concerns or priorities than other groups. And I just put in here the image of the map, and you can just see that the darker the colors are the most vulnerable groups, and then the lighter colors, those yellows, are the less vulnerable populations in the state. So this is the larger image of the whole state of New Hampshire. And then if you look just zoomed in on our greater Nashua region, you can see where the more vulnerable are than the less vulnerable. So if you took some of those other maps that we're looking at, oftentimes you still see some of those same hot spots showing up. But what this does is it takes a whole series of indicators and creates that index. So it kind of does a little computations to show how these neighborhoods or these census tracts are being, compared to one another and which ones are more vulnerable than others. And they also took this concept and created a really neat interactive online tool where you can pull up the map and you can look at each indicator that they picked for these social determinants of health, and you can pull up the map and you can zoom into your region or your town and play around with it. So it's really neat, and we're actually going to be having a training on that, and I'll mention that in another minute. And I just also want to show that the Centers for Disease Control and Prevention have a social vulnerability index as well. And this is neat if you want to look at the whole country and be able to look at this sort of index and which populations are more vulnerable than others. This is really nice to look at the whole country and different variables. So this is available. The link's down at the bottom if you want to pull it up and play around with it. So the training I mentioned is going to be here in our region on April 21st. It's a free 2-hour training that is going to be all about learning to use and navigate the Social Vulnerability Index that was developed by the New Hampshire Department of Health and Human Services. So we'll have about 20 to 25 seats available for the training, and we're going to send out more information soon. So if you liked what I talked about today and you're really interested on hearing more and being able to look at the data and see how it plays out in different communities, and I would highly recommend the training to you. It'll also have some group discussion and some small group discussion on how do we look at health equity and these social determinants of health, and how do we take health priorities and make change in communities. So it's a neat training, and I'll be sure to send out to everybody that registered for this webinar. I'll send you that flyer when it becomes available. In here are some resources. So there's lots of links on social determinants of health and also our health tool and our health assessment. So that's available. And I just wanted to highlight this other tool about how do we talk about social determinants of health. They can be really political, as you can imagine, when you're talking about income and jobs and education. So Robert Wood Johnson Foundation put out a toolkit on how do we talk about this so that we're, not on either extreme, but we are taking everybody talking about things that are of mutual interest to all sides and working to try and make that change. So this is a really nice tool if you're talking with, decision makers. And then here's my contact information. Happy to get feedback from you on our tool and what we've done together. And again, I just want to thank our GIS department here in the city and our intern Robin for all of our hard work on this project. So we're pretty excited about it. And what I'm going to do now is just make sure that everybody's unmuted. And I'm going to stop my screen sharing for just a second. We're going to